level 2 ART clinic to deposit their samples. Whereas if we see about donor X, ART banks do the screening and registration of the donors. Once they have registered the donors are sent to level 2 ART clinic, that is, they will be sent to us, where we will be doing their examination, and once we have confirmed that it is the right donor for the patient, the further management, that is collection of the eggs, the stimulation of the donor and the egg retrieval will be done at a level 2 ART clinic. So the banks are not providing us with the donor eggs, they only provide us donor females, and they will be sent to the level 2 centers. In level 2 ART clinic, a gynecologist, the doctors which are hired are the gynecologists who have a postgraduate degree in gynecology and obstetrics. They should have a record of performing 50 oocytes under supervision, or at least 3 years of training in a registered ART center, or a super specialty, that is DM or fellowship in reproductive medicine, or experience of not less than 3 years in reproductive medicine. So after this criteria is fulfilled, then only a doctor is eligible to perform ART procedures in a level 2 ART center. Whereas in level 1 ART center, a gynecologist, if she has a post-graduation in obs and gynae, she is very well eligible to run the center. So now with this, I come with the first case situation. There's an elderly couple wherein the female's age is 49 and male is aging 56. They come to your OPD after seeing the news wherein a celebrity whose parents have conceived at the age of 55 and more. Now you are their family doctor and they are very hopeful to become parents as soon as possible. Now how will you help such a couple? Anyone from the audience would like to answer this? कि अगर आपके पास कोई कपल आता है जिसमें एल्डरली एज है कपल की, एज फीमेल की 49 है, मेल की 56 है, एंड उन्होंने अभी न्यूज़ में जैसे हम देखते हैं बहुत सारे एल्डरली एज में कपल्स जो हैं पेरेंट्स बन रहे हैं, सो दे आस्क फॉर योर एडवाइस. सो आप क्या उनको एडवाइस करेंगे? क्या आप उनकी हेल्प एक्चुअली कर सकते हैं? आप IVF करेंगे, IUI करेंगे?
IUI को रिकमेंड करेंगे, जो प्राइमरी डायग्नोसिस वगैरह है, AMH लेवल वगैरह तो करवा सकते हैं, उसके बाद इनको कर सकते हैं.
Anybody else would like to differ or have a? I think
मैम ART का बाद में सोचेंगे, पहले तो मेडिकल डिफरेंस टूट आउट करेंगे.
At this age, we have to look. Age is the main criteria for this. So I don't think that IUI, I'm sorry, but IUI के लिए time लगेगा, so we have to go for level 2.
Yeah.
I think. So I personally think we should spare the time. We don't have to spend. I mean, उनका time waste नहीं करना चाहिए because we have very less chances of getting them conceived. So I think मैं अगर होती तो time waste किए बिना I suggest level 2.
So exactly, I'm with you on this, that the treatment for this couple is IVF. Firstly, because they are in extremes of their age. Secondly, there is a very high chance that they might not get pregnant, especially for the female part. We might need donor eggs or we will be requiring donor eggs. But the biggest challenge is that the ART Act mandates that for a couple to be eligible for any sort of ART treatment in India, the female should not be more than 50 years of age and the male partner should not be more than 55 years of age. So there is a lot of confusion जिसमें ये बोला जाता है कि husband और wife की combined age 105 तक होनी चाहिए, उसके ऊपर नहीं होनी चाहिए. That is all obsolete. अगर एक भी partner अपना criteria match नहीं करता, we cannot register them under ART Act. इसलिए जो भी आप न्यूज़ में देखते हैं कि elderly age में couples जो है pregnant हो रहे हैं, they move outside India for such services. In India, according to the ART Act, they are not eligible for treatment. You are a so now I move to the second clinical situation. You are a postgraduate doctor. A 30-year-old patient comes to your clinic with complaints of infertility. On questioning, you find out that she just got married 6 months back, but is in a hurry to have a child naturally. So in this current scenario of ART Act, what will you do for her? So अब जो patient है, she is only 38 years of age.
Please.
मैं डायग्नोसिस के बेस पे करेंगे, इनका तो 38 ईयर एज है अभी, सो 38.
So yes.
एज इसमें मेन फैक्टर है और आपने जैसे बोला कि 35 इयर्स ओल्ड है सिर्फ, तो फर्स्ट ऑफ ऑल इन्वेस्टिगेशंस ही करेंगे ना, उसके इन्वेस्टिगेशंस में ही देखेंगे क्या प्रॉब्लम्स है, हो सकता है उसकी जरूरत ना हो आईवीएफ,
हाँ जी.
इसलिए इन्वेस्टिगेशंस ही फर्स्ट.
So you rightly said, चाहे पेशेंट हम IUI करें, चाहे IVF करें, चाहे हम कोई साधारण सा ही ट्रीटमेंट करें, सबसे पहले जो करना है हमें पेशेंट को इन्वेस्टिगेट करना है. जब हम इन्वेस्टिगेशंस की बात करते हैं तो एक और चीज है कि पेशेंट जो है ठीक है 49 नहीं है, 50 नहीं है, बट 38 एज है. And we all know that after the age of 35, and nowadays in today's era, after the age of 32 also, the egg reserve and the egg quality, it starts to get poorer. Okay, so even if we have investigated, so first and foremost आप इसका investigations तो करेंगे भी, but obviously she wants to get pregnant as early as possible. So हमारे पास बहुत भी टाइम नहीं है कि हम उनको सिर्फ ovulation induction का tablets खिलाएंगे and we will not do anything else. So to expedite, at least we can think about IUI. Okay, so IUI से हम सोच सकते हैं considering all the investigations are normal. Now in this current scenario of ART Act, most of the doctors are not registering for level 1 ART clinic. What are the practical problems of doing IUI as a level 1 clinic? So बहुत सारे डॉक्टर्स हैं जो पहले IUI करते थे. I just want to know कि आप में से पहले कोई डॉक्टर्स हैं या अभी कोई डॉक्टर्स हैं जो IUI जैसे प्रोसीजर्स करते हैं? पहले करते थे. तो सिमिलरली बहुत सारे गायनेकोलॉजिस्ट भी हैं जो पहले IUI करते थे, लेकिन जब से एक्ट पास हुआ है उसके बाद से they have stopped the simple procedures like IUI. Why? Because the act mandates that the center should be registered. Even a level 1 ART clinic should be registered. The registration amount is nearing around 1 lakh and it has to be renewed after every 5 years. For a level 1 clinic also there is a mandatory staff which requires a gynecologist, a counselor and an endocrinologist. There is a mandatory equipment which has to be there, other licenses of the ART, PCPNDT, there should be proper data maintenance for the records. All this adds to the cost of the clinic and also cost of the IUI to the patient. So now the same doctor जिनके पास वो 38 years patient गई थी, वो चाहते थे IUI करना, but then she realized that to do IUI she should register her clinic as level 1. Unfortunately, her workload is not much. She has substantial number of patients, but only 4 to 5 IUI patients in a month. So she asked her IVF friend for her advice. How can we help her? Should she register her clinic as level 1 or should she just refer the patients to us or to an IVF center? So in such scenario, how do we help? Because first of all, there are two challenges. एक तो डॉक्टर का जो है पोस्ट पीजी होना हॉस्टल गायनी में. सेकेंडली आपको अपना क्लिनिक जो है वो लेवल 1 ART के लिए रजिस्टर कराना है. So in such scenarios, how do we help you? Because sometimes distance is also a matter of concern, क्योंकि पेशेंट को अगर 3 से 4 बार आना पड़ता है तो कई बार पेशेंट को प्रॉब्लम होता है. So you also feel that there is something which can be done at your end before the patient comes to us for the final treatment. So what we advise is that you do the preliminary investigations at your center. जो investigations चाहिए, उसके बाद we can formulate a plan that this patient requires IUI, for example. Then you can send the patient to us first for the first time on day 2 of the periods. On day 2, when the patient comes to us, we can register the patient because no treatment can be given without the couple getting registered at the level 1 or level 2 clinic. Then we set the protocol. जो भी हमको ovulation induction drugs देना है उनको, we can formulate the protocol and we send the patient back to you. आप अपने सेंटर पे उनको वो ड्रग्स दे सकते हैं. आपको चाहिए तो आप नियर बाय सेंटर से अल्ट्रासाउंड मॉनिटरिंग करा सकते हैं और हमसे कंसल्ट कर सकते हैं बीच बीच में. So this is the way the patient does not have to visit multiple times for a small procedure like IUI. And then जब हमको लगता है कि patient ready है for the trigger and all, then you can directly send the patient to us on the day of IUI, and we would love if you want to accompany the patient on the day of the procedure. So the same doctor gets a patient. Now I'm moving to the fourth situation, wherein you get a couple wherein the patient requires a donor IUI as husband has azoospermia. The couple is hesitant regarding the donor. They have many questions in their mind for how the donor will be, how they are selected, how will be the semen sample. So what are the criteria for donor semen sample or donor oocytes? And also the couple insists that they want to try with the cell sperms. You prescribe them medicines, you give them Shilajit, Ashwagandha, you have even tried antioxidants, but no help. So can your level 2 IVF friend help in that? So first we'll address the first question, what are the criteria for the donors? Now as I told you that for any couple who require donor gametes, whether it be egg or sperm, we have to contact an ART bank. And the age for the male donors is between 21 to 55 years of age, whereas for the female donors, the age is between 23 to 35 years of age. Now they say that the donor should be between 23 to 35, but in our practice we have found after the age of 32, 33, the egg quality becomes poorer and also the result is also sometimes not up to the mark. So I prefer that if I'm taking a donor egg for a patient, then the oocyte donors should not be more than 28 or 29 years of
देखो
age.
पहला क्वेश्चन
From our
what
side, we
is
also make sure
the
the
best
act
IVF
does not mandate it, but we make sure that the donor has a
आ
child
गया
who is
YouTube
normal
पर चल रहा है
genetically
लाइव.
and everything, so that we are able to give the couple a healthy child. So these are some of the precautions which we take from our side so that the couple is benefited in the maximum way. In the similar way, you can see that the age criteria for the semen donor is between 21 to 55. So 55 sperm age, the age of the semen donor also matters a lot. So we prefer from our side that the donors are within the age limit of up to 30 years. Also, the donors which we take for a couple, the women can donate her eggs only once in a lifetime. So nowadays after the act has been passed, they are exclusive donors. We cannot share their eggs for any other couple. So we also make sure that they have never donated in the past, nor that they cannot donate in the future. So these are now exclusive donors for the couples. And we cannot retrieve more than 7 eggs from her. And with the help of our embryologist, Mr. Wasim, we make sure that the patient gets at least 6 to 7 good embryos so that they have a fair chance of getting pregnant. And with these numbers, we can give them at least 3 to 4 chances of IVF, even for their future pregnancies. So now addressing the second question, when the couple insists that they want to try with cell sperm. So कई बार बहुत सारे couples आते हैं जिसमें male infertility होती है and sometimes it is very difficult for them to accept कि सीमेन की तरफ से इतना ज़्यादा प्रॉब्लम है, तो वो आपको बोलेंगे नहीं हमें तो मेडिसिन खाना ही है. So especially जब एजोस्पर्मिया होता है, medicines do not have much role to play, but फिर भी कई बार पेशेंट की खुशी के लिए भी हम भी आप लोग भी उनके सेटिस्फैक्शन के लिए मेडिसिन देते हैं, लेकिन अगर हेल्प नहीं होती है, so we have lot of sperm retrieval techniques like PISA, microtessay, PISA. With the help of these techniques, sometimes semen में sperms absent है, but we are able to retrieve sperms. Now this is the area where obviously cross-referral plays a very important role, as ma'am said, because if we are retrieving sperms directly out of the testes, these sperms can only be used if we are doing IVF process. So in a natural cycle आप ये sperms नहीं use कर सकते, वो sperms हम केवल और केवल IVF के through use करके couple को pregnant कर सकते हैं. So now I would like to address how we at Nova IVF are different from other IVF centers. You have You must have attended many CMEs, maybe with many IVF doctors. But we at Nova IVF, we believe in strong doctor-to-doctor connect. By that I mean that whenever a patient is referred from you, you are the primary contact of the patient. Also at times we feel when we refer our patient to another doctor that patient से हमारा टच चला जाता है. और also we also feel sometimes जब patient आपके पास से आता है, patient has lot more trust on you. हम जो भी उनको ट्रीटमेंट बताएंगे, they'll come back to you, they'll cross check with you कि आपको पता है कि नहीं कि हमको क्या बताया हुआ है. तो वहाँ पे अगर कोई भी लूप होल होता है तो पेशेंट को लगता है कि नहीं, मेरे डॉक्टर ने जिन्होंने मुझे भेजा था उनको तो कुछ पता ही नहीं है. So we believe that there should be a strong doctor-to-doctor connect, and this we maintain by two ways. Either by personalized phone calls, that whenever a patient is there who has come from you, I from my side make sure that you are kept in loop from the day one. पहला कि हमने पेशेंट को क्या ट्रीटमेंट एडवाइस किया है. सेकेंडली, जब ट्रीटमेंट या जब आईवीएफ साइकिल स्टार्ट हो जाता है तो आज हमने क्या किया है, एग रिट्रीवल का प्रोसीजर कब है, एग्स रिट्रीवल हो गए हैं तो कितने एम्ब्रियोज बने हैं, हम कब ट्रांसफर करना चाह रहे हैं, सो दैट व्हेनेवर दे कम टू यू, यू ऑलवेज आर अवेयर कि पेशेंट की साइकिल में क्या हो रहा है. Secondly, we also prefer sometimes कि we form a WhatsApp groups also, but obviously if you are comfortable, then हम आपका, हमारा और हमारे जो टीममेट्स हैं, कोई भी एक टीममेट के साथ मिलके हम एक पर्सनलाइज्ड ग्रुप बना लेते हैं और उसमें हम आपको सारी इन्फॉर्मेशन शेयर करते रहते हैं. Second, referral back. So we also believe in cross referral. If the